Alrighty, good morning. Welcome to this Friday edition of the Town Meeting program. And while things are obviously challenging these days, we want to wish you all the best for the spring season, which is now upon us. Might not get to enjoy it in the ways that we typically think of, although fortunately going outside is not part of the social distancing, sequestration whole thing. Just need to maintain the distance, but if you find some weather you want to be in, go for it. And a big thanks again as we start out the show to its sponsor, Cordova Wireless Communications, your local cell phone provider, providing your local talk show here on KLAM. And we are going to get caught up now on the latest news regarding COVID-19, of course, at the state and local level. Couple of things coming out of the administration, the state administration, had a press conference yesterday and said there are 3 new cases of COVID-19, bringing the statewide total to 12. 2 new cases found in Fairbanks, 1 additional case in Ketchikan. And there's concern now, and it doesn't come entirely as a surprise, but concern at this point that the 2 cases in Fairbanks, the new cases there, are not people that traveled outside the state in the last 2 weeks. So they've kind of differentiated between people catching this that got it outside and brought it back to Alaska, but there hadn't been this community spread where people in Alaska are giving it to each other. Now we may kind of be seeing the start of that. That's the concern anyway. So these 2 new cases in Fairbanks may have caught it from a fellow Alaskan. So the state is investigating those newest cases. And actually an update came out yesterday, I think it was yesterday, that one of the positive test results from the previous batch, when the number jumped from 6 to 9, one of those was an airman at Joint Base Elmendorf-Richardson in Anchorage that had recently returned from overseas travel. And they've got that person isolated at an off-base home. But again, that was another travel-related one. Now, again, there's a possibility, and they have to investigate, but there's a chance that some of these newer cases are starting to be passed from Alaskan to Alaskan within Alaska. So, of course, the efforts being made by our local experts on this to self-quarantine if you have been outside the city. You know, as soon as you get back to Cordova, please just isolate yourself for the 14 days. And we'll get into that a little bit later. Yesterday also brought another COVID-19 health mandate from the governor's office. These are the same types of mandates that closed the schools and closed the restaurants and bars and so forth. This one has to do with elective medical procedures. The Public Health Disaster Emergency Declaration signed by Governor Dunleavy on March 11th provides for health mandates to be issued when deemed necessary by the Alaska Department of Health and Social Services, the Alaska Chief Medical Officer, the Alaska Division of Public Health, and the Office of the Governor. This one, Mandate 5.1, has to do with elective procedures. So the rule now is that all patients, providers, hospitals, and surgical centers are required to postpone or cancel all non-urgent or elective procedures for 3 months. So that would put us into April, May, June, about June 20th or so. And the purpose is to decrease the overall impact on the Alaska healthcare structure and preserve that personal protective equipment, the gowns and the masks and so forth. Stretch those supplies out. This would include pre-scheduled surgeries that are deemed non-essential, but the mandate does not apply, of course, to surgical cases coming through the emergency room or an existing hospitalized patient. The mandate says that because the terms non-urgent or elective are not fully defined, the state is recommending that each hospital create a physician task force that would be able to evaluate on a case-by-case basis and make a determination on borderline surgeries. The statement concludes by saying, given Alaska's distances and limited healthcare capacity, it's especially important to open as many acute healthcare beds as possible for the anticipated COVID-19 care, and again preserve the personal protective equipment. The state of Alaska believes that delaying non-emergency procedures is a protective measure both for patients and the healthcare workforce, and will better prepare all of them for the anticipated impact COVID-19 will have on the healthcare system. So again, the requirement out of this new state mandate is postponing or canceling all non-urgent or elective procedures for 3 months. Now, let's turn to the latest release from the city. And again, this represents the very fine work of not only the city, but also the Cordova Prepared Group, CCMC, Alanka. They all work together on these. So in the March 19th update, and these come out in the evening, so this is the most recent one, City of Cordova has no cases of COVID-19. City facility closures include the Cordova School District, Cordova Public Library, Cordova Historical Museum and Gallery, Bedarkey Recreation Center, Bob Corn Memorial Pool. DMV is available by appointment only between the normal hours of Tuesday to Thursday, 8 a.m. to 3:30 p.m. till further notice. Again, that's by appointment only. Don't drop in, but make an appointment. Only one person will be permitted in the DMV office at a time. Please call 6125 to schedule your appointment. Regarding City Hall, that will be available by appointment between the normal hours, and that's appointment only, again, between the normal hours of Monday to Friday, 8 a.m. to 5 p.m. until further notice. Utility payments can be dropped off in the drop box located near the exit of the upper parking lot. You can also contact the Finance Department regarding other matters at Finance2, again, that's the number 2, Finance2 at cityofcordova.net and Finance3 at cityofcordova.net. If you want to get an appointment to visit City Hall, call 6200. Beginning today, the Harbor office will be closed to walk-ins. Payments can be made by mail or phone, Monday to Friday, 8 a.m. to 5 p.m. Appointments can be made to purchase shower tokens in bulk, Monday to Friday from 8 to 5. Shipyard services are also by appointment. And starting today, the Harbor Department will not be accepting mail or packages. If you have mail or packages being delivered to the Harbor office, please make other arrangements for those. Now, the City of Cordova Emergency Management Organization and its community partners have been closely monitoring the COVID-19 situation and are following best available guidance from the Centers for Disease Control and Prevention and the Alaska Department of Health and Social Services. Tests have been administered in Cordova, and all tests received to date have been negative. They still say if you have flu-like illness or respiratory symptoms like increased fever, persistent fever that stays above 100.3, and or shortness of breath, please call ahead before coming into the medical facility. That applies to the emergency room and both of the clinics. I know this is getting redundant, but again, the reason they want you to do that is not because they don't want you to come in, but because they want to prepare to receive you. They want to have the medical personnel, because we don't have, obviously, nearly as many doctors and nurses and so on as larger communities. So they want our people to be able to mask up and get their protective gear on so they're ready to receive you. So please, if you are going in with concerns about respiratory illness, call ahead before you go in. Back on Tuesday, the City Emergency Management Organization formed and activated its Incident Management Team to begin implementation of the city's emergency operations plan and take necessary actions to prevent the spread of coronavirus in Cordova. And back on March 11th, Cordova City Manager issued that local emergency declaration. The City Council did vote to extend that declaration which enables the incident management team to continue to have the authority to take actions to reduce the impact and spread of the virus in our community. An update regarding ports of entry. The City of Cordova Emergency Management Organization is making efforts to monitor and protect our points of entry, although completely closing those is not an option right now. Efforts are being made to educate travelers when coming through the local airport to social distance and self-isolate. The EMO has also been in communication with Cordova's larger seasonal employers and will be reaching out to the commercial fishing fleet to discuss mitigation strategies. More information on this will be shared as it becomes available. So, and there's been a lot of concern. You see it on social media and so forth that, what's going to happen once fishing season ramps up and a bunch of people are coming in. The emergency management organization is on top of that and doing their best to get the information out. Now, here's some good specific information for anybody coming back from travel or entering Cordova from elsewhere. This is what they'd like everybody to do. To prevent or slow the spread of COVID-19, the City of Cordova strongly encourages adhering to the State of Alaska's mandate, and this again was guidance but is now a mandate, regarding coming back to Alaska and, by extension, coming back to Cordova. If you have traveled from an area with widespread, ongoing community spread, this is where people within a city, for example, are giving it to each other. And this includes Europe, China, other countries listed as high risk by the CDC. If you've been any of those places with ongoing community spread and are entering Alaska, you must stay home and avoid contact with other household members. Contact your employer and don't go to work for the 14-day period after you return. Now, less severe but still significant, if you've traveled anywhere outside of Alaska, including the rest of the U.S., in the past 14 days, it's required that you keep your distance from others by about 6 feet. And this may mean not going to work if you can't safely distance from other people, especially if you've traveled to a location where this community transmission is occurring. Contact your employer. Tell them you need to stay home. Also, you must avoid crowded places such as shopping centers, movie theaters, that kind of thing, and limit your activities in public. There's some health guidance for returning travelers in both the higher and medium risk group. First off, take your temperature with a thermometer 2 times a day to monitor for fever and also watch for cough or trouble breathing. If you get sick with a fever of 100.3 or more, if you've got cough or shortness of breath, call your health care provider. Again, please avoid crowded places like shopping centers, movie theaters. Limit your activities in public. Keep your distance from other people. 6 feet, again, is the guideline. And if you seek medical care for other reasons, such as dialysis, again, call ahead to the doctor and tell them about your recent travel. And that section concludes with a reminder that all Alaskans should follow previous guidance, including regular hand washing, cleaning surfaces, and avoiding large gatherings. Now, next item. This release also includes a message from the local health care providers who say as we continue to take measures to prevent the spread of COVID-19 within our communities, we want to send out information on local resources, and they thank everybody for keeping the community safe and healthy. So they start this part by saying if you've got respiratory symptoms, dry cough, shortness of breath, the fever of 100.3 or greater, again, please call ahead before coming into a medical facility, whether it's the ER or a clinic. CCMC is 424-8000. Cordova Community Medical Clinic is 8200, and Alonka is 3622. And by the way, we're going to, again, try to get the text of this on our Facebook pages. So if this is going by too fast, then you can check there and read it. For prescriptions, call those prescription refills and requests ahead to the Medical Center Pharmacy at 8017, and they're making curbside delivery available. Now, a number of phone numbers here regarding food, and if you, I guess if you want to grab a pencil to jot these down, or, again, you can check our Facebook pages. There are people waiting to take your calls regarding the CCMC Senior Lunch Home-Delivered Meals. You can talk to Monica Shaw at 429-3167. The Salvation Army Food Bank, if you want to contact them, talk to Stephen at 429-6262. The food bank at the native village of Eac, and by the way, that one requires proof of income and one utility bill. But if you want to contact that food bank, 424-7738. AC is offering home delivery between you call in the order before 11 a.m. and then they'll deliver it to you after 2 p.m. So if you want to contact AC, that's 7141. CAM2 Center is also doing deliveries. They'd like your order called in before noon. Then they'll do deliveries after 2. Their number is 3124. And then Nichols has home delivery available. They don't specify times, but their phone number is 5219. If you want to make a phone call to get general information about COVID-19, the Alaska Health and Social Services folks have put out that 211 number. So that's an easy one to remember. Call 211. And, of course, there are a lot of online resources, which, as I said, we will get printed up on our Facebook pages for you so you can see these web addresses. And I mean, again, there's a great big list of them. The village of Eac put out an announcement that due to potential health concerns over COVID-19, the native village of Eac, tribal court, Alanka Cultural Center, and newspaper offices will be closed starting Monday until further notice. Their staff will continue working remotely during the regular business hours, Monday to Friday, 8 to 5. If you have questions or are in need of the services they provide, call 7738. The Alanka Community Health Center will, of course, remain open during regular business hours, Monday to Friday, 8 to 5:30, and Saturday, 10 to 2. If you have symptoms of COVID-19, again, that's cough, persistent fever that stays at 100.4 or higher, or shortness of breath, please call ahead and speak to the nursing staff, again, so they can get ready to help you without getting sick themselves or making other people sick. They can get their protective gear on and all that. Their phone number is 3622. Due to CDC recommendations to help prevent the spread of the virus and stay safe and healthy, all NVE events have been canceled until further notice. Regular tribal council meetings will be done by video or teleconference until further notice. And if you have any questions, you can contact, this is regarding Village of Eac now. Any questions, contact Raina at 7738. Or if you want to email, it's Raina, R-E-Y-N-A, at eac-nsn.gov. So that about covers it from their latest release. The rest of it is rehashing some of the national guidelines. Remember that, again, there are good local resources. If you specifically want to know what our Cordova experts on this are releasing in the way of information and guidance and so forth, you can go to the City of Cordova website, cityofcordova.net, and look for the Cordova Prepared page. They also have a Facebook group, Cordova Prepared, which has become a good way for funneling official information from the Cordova Prepared and the city and CCMC, all this official information that's been vetted by the Cordova Prepared people, so you know it's not hoaxy and so forth. That Cordova Prepared Facebook page is a really good asset. And if you want to ask the Cordova Prepared people something directly, they have an email address set up, cordovaprepared@yahoo.com. That's what we've got for you. If you missed any of this, I imagine Robbie will get the show archived very soon. on our YouTube channel that he created called Cordova TV. The address is youtube.com/Cordova TV. Thank you again so much for a big supporter of local radio, Cordova Wireless Communications. That's why we're able to do this program for you. And everybody, enjoy spring as best you can. Stay safe. Maintain social distancing. Wash your hands. And try to enjoy, to the best of your ability, this time to sort of slow down a little bit. You know, we're all sort of being forced to take a breath and chill out, and gives you more time to think and read to your kids, or, you know, just enjoy as much as possible. Obviously, loss of income issues and worrying maybe about elderly folks and that kind of thing, it's not to be dismissive of that and say, oh, well, you know, just don't worry, just ignore it. But, you know, where you can find these areas here and there of an opportunity to sort of pause and meditate a little bit, we certainly hope those opportunities present themselves for you. Thank you again for listening. We'll get the rest of your 10 a.m. hour programming in. This has been the Town Meeting Program, brought to you by Cordova Wireless on KLAM.